So let's talk about something serious, something that hits close to home for me and for millions of South Africans. We're talking about our hospitals. These are supposed to be places of healing, of safety, of trust. You go there when you're at your most vulnerable, expecting care, expecting help. But what happens when that trust is broken? What happens when the very system designed to save lives is rotted from the inside by corruption? Today, we're pulling back the curtain on a scandal that's not just about numbers and budgets. It's about people, real people. Our grandmothers, our brothers, our children, whose lives are being put at risk every single day. This isn't a story from some far-off land you can just shake your head at and forget. This is happening right now, in our communities. We're going to walk through the corridors of some of South Africa's most well-known hospitals, and I have to tell you, what we found is shocking. It's a story of greed, neglect, and a complete betrayal of public trust. From ghost employees to dodgy contracts worth millions, the schemes are as creative as they are destructive. These aren't just isolated incidents. It's a pattern, a sickness in the system that's costing lives. So get ready, because we're about to go on a journey that will make you angry, it will make you sad, and it should make you demand change. The list of hospitals we're going to cover might surprise you. Some of these are names you know, institutions you might have even trusted. But the truth needs to come out. Because if a hospital can't be a safe space, then where can we be safe? Let's get into it. First up, the legendary Chris Hani Baragwanath Hospital, Bara. It's the largest hospital in Africa, a place that should be a beacon of hope. But instead, it's become a symbol of systemic failure. Imagine this. You have a hospital so vast, yet reports have shown that basic supplies go missing. We're talking about everything from food meant for patients to critical medical equipment. Investigations have uncovered syndicates operating within the hospital, creating ghost employees who collect salaries, while real, overworked doctors and nurses struggle with staff shortages. It's a place where life and death hang in the balance, and someone is busy creating a fake payslip for a person who doesn't even exist. Think about the impact. When millions of rands are siphoned off through fraudulent contracts for services that are never rendered, it's not just paper that gets hurt. It means fewer beds for the sick. It means broken MRI machines that stay broken for months, delaying life-saving diagnoses. Patients have spoken out about the dire conditions, the long waits, the lack of basic dignity. This isn't just mismanagement, it's a deliberate, calculated theft from the most vulnerable people in our society. The corruption at Bara isn't just a scandal, it's a life-threatening illness that the hospital itself is suffering from. Next, we head to Pretoria, to the Steve Biko Academic Hospital. Named after an icon of justice and integrity, you'd expect the highest standards. But the irony is just painful. This hospital has been plagued by allegations that would make Biko turn in his grave. We're talking about reports of bribery rings where, allegedly, you have to pay a facilitation fee just to get the treatment you're entitled to. Can you imagine? Being sick, scared, and then being told you need to slip someone a bribe to get a bed or to move up a surgery list? It's extortion at its most cruel, preying on desperation. And it doesn't stop there. Mismanagement is rampant. There have been stories of critical positions being filled not based on merit, but on connections, leading to a breakdown in leadership and accountability. Whistleblowers who have tried to speak out have faced intimidation and threats, silenced for trying to do the right thing. When the management of a top academic hospital is compromised, it has a domino effect. It affects the quality of training for new doctors. It erodes the morale of the dedicated staff who are trying to work honestly. And most importantly, it puts every single patient who walks through those doors in jeopardy. Now let's talk about the Charlotte Maxeke Johannesburg Academic Hospital. This place has been a hotbed for what we call procurement fraud. It sounds like a boring technical term, but let me break down what it really means. It means the hospital needs to buy something, let's say 1,000 boxes of gloves. Instead of paying the normal price, a corrupt official gives the contract to their friend's company, which charges 10 times the amount. That extra money? It gets split between them. It's a simple, dirty trick. And at Charlotte Maxeke, it's been happening on a massive scale with everything from cleaning services to critical medical supplies. The consequences are devastating. A fire ravaged parts of the hospital, and the subsequent repair contracts were themselves mired in controversy, with inflated costs and endless delays, keeping crucial sections of the hospital closed for far too long. This isn't just about wasted money, it's about stolen care. Every rand stolen through a dodgy tender is a rand not spent on a cancer patient's chemotherapy, a newborn's incubator, or a surgeon's sterile equipment. It's a direct line from a fraudulent invoice to a patient's suffering. The greed of a few individuals has crippled a vital institution, leaving patients and ethical staff to pay the ultimate price. Let's go down to the coast, to Durban's Addington Hospital. Here, the corruption gets even more personal, more brazen. We're not just talking about high-level tender fraud, we're talking about allegations of widespread theft by the very staff entrusted to care for patients. There have been numerous reports and patient complaints about personal belongings going missing from their bedsides. Phones, wallets, even clothes. But it gets much, much worse. The theft allegedly extends to hospital property and, most terrifyingly, medication. Imagine life-saving drugs meant for the sick being stolen and sold on the black market. This creates artificial shortages within the hospital, meaning a patient who desperately needs a specific antibiotic or painkiller might be told, "Sorry, we're out of stock." It's a betrayal on the most fundamental level. This culture of theft, if the allegations are true, points to a complete breakdown of security and ethics. It fosters an environment of distrust, where patients are not only worried about their health, but also about the safety of their possessions, and whether they're even receiving the medicine prescribed to them. It's a sickness within a sickness. The story of Tembisa Hospital is one of the most chilling and tragic examples of how deep this rot goes. This isn't just about money anymore. It's about life and death. Not just for the patients, but for those who dare to speak the truth. Babita Deokaran, a senior finance official and a dedicated public servant, was a whistleblower. She flagged hundreds of millions of rands in suspicious payments and possibly fraudulent contracts coming out of Tembisa Hospital. She was doing her job, she was protecting the public's money. And for that, she was assassinated outside her home. Her murder exposed a web of alleged corruption so vast it's hard to comprehend. We're talking about a hospital spending outrageous amounts on everyday items, like paying nearly 500,000 rand for 200 pairs of skinny jeans. Yes, you heard that right, skinny jeans. While the hospital faced critical shortages of actual medical necessities. Babita's sacrifice pulled the curtain back on a syndicate that was allegedly looting the hospital with impunity. The Tembisa scandal shows us the terrifying finality of corruption when people are willing to kill to protect their criminal enterprises. You know, the system isn't just broken, it's being held hostage. Even a place like Groote Schuur Hospital in Cape Town, famous for the world's first heart transplant, a symbol of South African excellence, is not entirely immune. While it may not have faced scandals on the same scale as Tembisa or Charlotte Maxseek, it operates within the same strained and vulnerable provincial health system. The pressures are immense, and where there is pressure there are cracks where corruption can seep in. There have been reports and internal investigations over the years looking into issues like procurement irregularities and favoritism in hiring practices. These might seem like minor issues compared to assassination and massive fraud, but they are the seeds of a larger problem. It's like finding a small patch of mold in a house. If you ignore it, it will spread. Mismanagement in one department, a dodgy contract here or there, it erodes the hospital's integrity from within. It demoralizes the staff who see rules being bent for the connected. For a hospital with such a proud legacy, even the shadow of corruption is a stain. It serves as a stark reminder that no institution is safe if the broader systems of governance and accountability are weak. Helen Joseph Hospital in Johannesburg has also found itself under the microscope. This is a workhorse hospital dealing with immense patient loads every single day. And recently, it's been the subject of serious investigations by the Special Investigating Unit, or SIU. The probes have been looking into allegations of improper and unlawful conduct related to the sourcing of goods and services, particularly around the response to the COVID-19 pandemic. This was a time of national crisis, a time when you would hope everyone would pull together. Instead, it's alleged that some saw it as an opportunity to profit. Investigators have been digging into contracts awarded for things like PPE and sanitation services, looking for inflated prices in companies that were paid for doing nothing. When a hospital is under this level of official investigation, it casts a dark cloud over everything. It makes you question every transaction. It makes the public wonder if the money meant to protect them from a deadly virus was instead lining the pockets of corrupt individuals. The findings of these investigations are critical to restoring any semblance of trust in the hospital's administration. In Durban, RK Khan Hospital has become notorious for a different but related kind of failure, a deluge of patient complaints that point to a system on the verge of collapse, often exacerbated by alleged corruption and indifference. Patients have shared horrific stories of neglect, of being left in corridors for hours, of unsanitary conditions, and of staff who seem completely overwhelmed or in some cases, uncaring. These aren't just service delivery complaints, they are cries for help from people who feel abandoned by the system. Behind this collapse in patient care are often allegations of corruption. There have been reports from inside the hospital of staff demanding bribes for basic services, of medication theft, and of a general culture of impunity. When resources are stolen or mismanaged, the first people to suffer are the patients. The lack of clean linen, the shortage of nurses, the broken equipment, it's all a direct consequence of a system where accountability has failed. The sheer volume of complaints from RK Khan suggests that this is not just a few bad apples, but a systemic rot that has left the community it serves feeling betrayed and unsafe. Now we travel to the northwest, to Mahikeng Provincial Hospital. This facility has been a poster child for political interference and its disastrous consequences on healthcare. For years, this hospital has been the subject of government probes and task teams sent in to try and fix a system that appears to be in a permanent state of crisis. The reports paint a grim picture: massive financial irregularities, appointments based on political loyalty rather than medical expertise, and a complete breakdown in the supply chain for essential medicines. This is what happens when a hospital becomes a political playground. Decisions are not made in the best interest of the patients, but to serve political agendas or to reward cronies with lucrative contracts. The Northwest Health Department was so dysfunctional it had to be placed under national administration. Yet the problems at Mahikeng Provincial Hospital persist. It's a tragic cycle where investigations are launched, damning reports are written, but meaningful change and accountability remain elusive. The people of Mahikeng are the ones who pay the price, forced to rely on a hospital crippled by the very officials meant to be its custodians. Finally, we go to the Eastern Cape, to Dora Nginza Hospital in Keberha. This hospital has faced intense scrutiny, particularly over its maternity and neonatal wards, which have been described as being in a state of perpetual crisis. We've heard heartbreaking stories of overcrowding, staff shortages, and equipment failures leading to tragic and avoidable deaths of mothers and babies. While the frontline doctors and nurses work under impossible conditions, the system above them has been riddled with allegations of corruption and mismanagement. Exposed scandals and ongoing investigations have pointed to deep-rooted problems. This includes everything from dodgy infrastructure projects that stall for years while costs balloon, to questionable procurement deals that fail to deliver the necessary supplies. When a hospital's maternity ward, the very place where life begins, becomes a place of danger and despair, it is the ultimate indictment of a failed system. The situation at Dora Nginza is a powerful, painful example of how corruption isn't an abstract financial crime. It steals futures and destroys families from the very first breath. So there you have it. 10 hospitals, 10 stories of betrayal. From Johannesburg to Durban, from Cape Town to Mahikeng, the pattern is undeniable and it is heartbreaking. This isn't just about stolen money, it's about stolen health, stolen dignity, and stolen lives. These are our friends, our families, our neighbors, who are being failed by a system that has been poisoned by greed. The dedicated, honest healthcare workers are overwhelmed, and the patients are paying the price. We simply cannot allow this to be our normal. We cannot accept that a trip to the hospital is a gamble with our lives. The question is, what do? We cannot be silent. We must be the voice for the victims of this corruption, for the whistleblowers like Babita Deokaran who paid the ultimate price. We have to demand accountability from our leaders, from our hospital administrators, from our public officials. This means demanding transparency in how our money is spent. It means demanding consequences for those who are caught with their hands in the cookie jar. We need to support the brave journalists and civil society organizations who are working tirelessly to expose this rot. This is where you come in. Your voice matters. Start by sharing this video. Get it in front of as many eyes as possible. Talk to your friends, your family. Let's make this a conversation that our leaders cannot ignore. The more people who know the truth, the harder it is for the corrupt to hide in the shadows. Together, we can create a chorus of outrage that is too loud to be silenced. Let's fight for a healthcare system that heals, not harms. A system that we can all be proud of. Thank you for watching.